Welcome back. We're continuing our discussion with Dr. Charlene Wong on the end of the COVID-19 public health emergency, which is good news, of course. Now, we've been talking about the vaccine and we still need to get it. Well, where do we get it? How do we get it?
So there are a lot of different places people can go to get the COVID-19 vaccine. Most healthcare providers, so I'm a primary care pediatrician, I'm giving a lot of those updated COVID-19 vaccines in my clinic. You can also go to a pharmacy. It's sort of like the flu vaccine, where you have a couple different choices for where you can go, but most pharmacies also you can walk in. If you're looking for a vaccine location, you can go to myspot.nc.gov and find a vaccine location near you.
I know we'll talk a little bit more about this in a little bit, but initially all of this was free. Is it still free for those who need it to have it free?
Yeah, so currently in North Carolina, we still do have COVID-19 vaccines available at no cost, and that doesn't matter what kind of health insurance you have, it doesn't matter your immigration status. Now, at some point, because the public health emergency has ended, as you mentioned, we will run out of the COVID vaccine that the federal government has paid for. At that point, it will still be available. So that COVID-19 vaccine will still be available. And people who say maybe aren't insured, there may be a cost associated with that. So it's sort of like the flu vaccine. So we really encourage people to get their COVID-19 vaccine now while we still have some of those supplies available. And then after that, it will be covered by most insurances. And again, there may be some cost associated with getting it.
This usually happens in fall because it seems to be a seasonal thing, and I hate it when school and all that is going to start, because then I start to worry again about COVID-19. So let's talk about what happens. I test positive. What do I do?
Yeah. So the most important thing to do immediately is try to stay away from other people. We don't want anyone infecting people around them. And then to follow the isolation guidelines put out by the CDC. Now, of course, it's very important if people are having a really hard time breathing, they're feeling really sick, we want them to call their doctor and get some medical attention right away. For some people, if they've tested positive for COVID-19, it might be that getting a COVID-19 treatment can help them. This is particularly the case, again, for some of the folks we were talking about earlier, people who have a higher risk of getting really sick from COVID-19. So again, people with heart disease, diabetes, women who are pregnant. So if you're wondering, would a COVID-19 treatment be best for me? We really encourage people to reach out to their healthcare provider. You can also find more information about different COVID-19 treatments at myspot.nc.gov/find treatment.
The thing was funny, my wife got what she thought was pink eye, all right? And the doctor said, did you take a COVID test? And here's my question, kind of the setup for the question is, the symptoms change because of the variants. So how important are these test kits? And there was a time they just show up in your mailbox to a point where I had to stack them. So that's not happening anymore. Can you still get free test kits?
So you can, and we really encourage, particularly as families might do some traveling over the summer, we really encourage people to keep those COVID-19 tests on hand so that if anyone's feeling sick, they have any of the symptoms that might be COVID, it's easy to do that test. In general, the symptoms for COVID have stayed pretty consistent, but as you've mentioned, there are a lot of different ones, that could be potentially COVID-19. So yes is the answer to your question. You still can get free COVID-19 at-home tests. If you go to myspot.nc.gov/test, you can find ways to either go pick up COVID-19 tests somewhere, or again, like you said, there are still ways to get them shipped to your house. Now, this is while supplies last, because at some point, again, we will run out of that supply that we have. We also still have available locations where people can go and get tested for COVID-19 at no charge. And again, that's, you can have any kind of health insurance, any kind of immigration status. But at some point, that will end as well. But right now, in North Carolina, we do still have some of those free tests available.
Are those tests still able to detect the variants?
They sure are, and that's something that we monitor and that our federal partners at the FDA and the CDC monitor. And so yes, those tests are still really working well to pick up the new COVID-19 variants.
And then just to wrap up this little segment is, you can get a test and you can also get treatment. At one point you could do that. Can you still do that?
You sure can. We call those our test to treat locations. And these are really convenient locations where people can show up because they're worried they might have COVID-19. They get the test and they also get that treatment for COVID-19 that can help with the symptoms. At this point, you don't have to pay for the treatment at those sites. At some sites, there might be a charge for the evaluation. But again, we really encourage people to go to myspot.nc.gov to get more information, because these have been really phenomenal locations for people to go one-stop shop, test all the way through treatment.
Yeah, and it's a great opportunity. Well, doctor, one more segment. Don't go away. I have so many more questions, and I bet you do too. So stay here with us, and we'll be right back.